It happens.
Video started. Wish I could do 2 angles. I'm just gonna get a video of this because you can see us and everything. Cool. Pretty mediocre, but it'll capture everything.
Is this the microphone?
Mm-hmm.
I love how you think it's mediocre and I'm like looking at it like, whoa,
Yeah,
that's
right.
cool. Mediocre, okay.
Technology.
Down, girls.
Stop.
Imagine if I'd had coffee.
Oh, you haven't yet?
No, because my stomach is hurt.
Did you pour some? Or is that tea?
That's tea. I'm trying to calm my stomach. It's not working.
Oh.
I'm going to shut that door because
I didn't know we were already joined.
watch what happens if I touch this.
No, don't do it yet.
Okay.
Okay, now you can do it. What's happening?
Oh, there it goes. A little bit. It must like, it went up there. It's a sensitivity plant. Usually when you touch it, there it goes.
Now it's sad. That's weird.
Mm-hmm.
Please reply. Reply. forget how to do that flipping thing.
Oh yeah. Oop.
No, I'm not. It's on.
Yeah.
You won't let almost. Oop.
I used to be able to do it a little bit.
Yeah, I remember you doing that.
Can't do it anymore.
Out of practice.
Remember Miss Pelusiak and the pencil?
Oh, yeah. Yeah.
Fun.
Do I look like him? That's my dad.
I was wondering who that was.
He was like 8.
Yes, you do.
Daniel does too.
Yeah, she does.
Oh. Maxine, go ahead.
I'm not going to be able to attend the Friday one. Because I'm declining the afternoon. I said, oh, this job.
The mic is muted right now, by the way. You don't have to whisper.
Okay. Have it, I guess. But this recording looks like that'll be good.
Yeah, just have to get another SD card.
The Patriots lost their game last night. Yesterday afternoon. Should have expected it.
It's alright, the Giants lost to the Cowboys.
Did they?
Yep. I hate the Cowboys.
Yeah, I'm not a big fan of Cowboys. Ever since the 80s.
Yep, I've hated them since then.
Yep. I had a friend in Virginia that he was a big Cowboys fan. It used to drive me crazy. He was one of those sore winners.
Ugh.
Yeah.
Yeah, that's kind of that Cowboys MO.
Yes.
Oh, do you have to pet it? Oh wow, look at that.
Yeah.
Did you see that? Watch this. It just like curls up.
Oh, wow.
I think it's distraught.
Looks sad. Don't touch me.
Did it have a top? Or no?
I don't think so. But I don't remember. Oh, now Nikki Owens.
Group meeting. Yes. I just work here.
Apparently this plant is a weed in South America.
But they grow really big.
Sensitivity one?
Mm-hmm.
That's very cool.
On Tuesday nights when I meet with my friends, I have to keep it away from Judy and Sierra because they're constantly trying to... Do you want one like that or a thicker one? Oh, this flatty. You do?
Yep.
Judy hates these. They give her the creeps. I can't have them around her on her side. She has weird phobia stuff. All I smell is dog pee, sorry. Heat.
You turned your heat on?
Oh,
Hello.
his glasses look like
Hello.
yours.
They sure do. Hello.
Hey,
Can you hear me?
Daniel.
Hi.
All right. It's been a while. How you been?
I'm alright. Thanks for asking. How are you?
Good, good. So, yeah. I didn't send her anything.
Yeah, as soon as there's an email, the office meeting with me.
Oh.
Okay, got it.
Yeah, we're just sending a link over to Dr. Shubin Stein's office.
Oh, awesome.
Oh, cool.
Still give it a second. Who's Nikki Owens?
Oh, I thought that was on your end. Nobody we know.
Okay. I wonder if Nikki's from Dr. Shubin Stein's office.
Yeah, I sent her office a link about 20 minutes ago to join. Yeah, we're live.
That's interesting because I also have a meeting that from her office on Friday at 2:15. So
Dr. Schubinstein's going to be on in just a second.
Oh.
I just spoke with her. Sorry for the delay.
Awesome.
You're from Beth's office?
Yes, I'm Dr. Schubinstein's athletic trainer.
Okay, great. Awesome. There we have it. They did get the link.
That's great.
Yeah.
It's nice when a plan comes together.
Isn't it? So you had a meeting also scheduled for Friday with her?
Yeah, that's what somebody from her office reached out and said to me.
Oh, okay.
Email.
Well, it sounds like she's going to be on now.
Cool, I did not know that.
You figured it out. That's good. Yeah, that was kind of the idea.
Well, that was
Because,
what I was looking for.
the way we left it was a while ago, was that we do kind of a two-pronged approach, which would be to get your patella aligned and in order. And then, once that's reduced and your knee's more stable, then we could actually lengthen your femur, get your knees at a similar level. Let's see the x-ray here again. So we have a long x-ray here. And then do a more, conventional amputation, which would be like mid-tibia-ish, and get you into a baloney prosthetic or an osseointegration. Now, have you looked into the osseointegration since we talked?
Yeah, I have quite a bit.
What do you think about that?
I think the pros are a lot over the cons of it, considering a lot of my issues with heat and weight bearing and sores and all the conventional socket issues.
Right.
Yeah.
So you're interested?
Yeah, I didn't know for a while that it was an option until I went through and watched a lot of the videos and reread it and noticed that you did say it was an option partially for, because I didn't know if I had enough, would have enough build height or lower limb left, I should say.
Right.
Okay. Hi, guys. Sorry for the delay.
Hey, Beth, Dr. Shubin's not
Hey.
on.
Hey, guys.
Hi.
Hi.
We didn't know you
All right,
were
I'm
going to be on, so we're thrilled.
Oh, no, my apologies I was trying to get the link through the invite, but I couldn't find it, so. All right.
So, yeah, we're putting this meeting together just to try to touch base and figure out, if we all agree on a plan.
Yeah.
Remember, so you've met Daniel, right, in the office before?
Yeah, Daniel, Nikki, is Nikki on, by the way? Nikki, are you on? So Nikki has access to my notes, which I don't have right
Doesn't
now.
look like she's
Nikki
in the
was
call
on.
anymore.
Yeah, she cut off to try to get me the link.
It was
So hold on one
it was May 20th of last
That's what I
year.
thought. I knew I was just trying to find the dates. Okay. So I'm going to actually, as we sit here, hold on one second. I'm going to bring up my notes and also your imaging so we can kind of all be on the same page at the same time. So hold on.
So we'll just review that Daniel has congenital short femur, a congenital knee patellar dislocation, congenital absence of ACL, and also has fibular hemimelia with a short tibia and a syme amputation.
Okay, and then, and I'm just going to look back at my notes, and I'm going to read what I wrote from my notes. Hold on, I'm just logging into Epic, Daniel. At first, I want to bring your imaging up, so give me 1 second.
Great.
I can share the imaging too. I have that here.
No, I got it. I'm just bringing it up right now.
Okay. The other thing, Daniel, is, most people like their knees to be the same level, but if you didn't care about that, then you could do the osseointegration of the tibia and not lengthen your femur and just have a longer prosthetic. So that is an option, you don't have to lengthen your femur.
I think a lot of my bodily composition problems come from the imbalance of my knees, though, because I do have, 3 inches or so of a discrepancy. Yeah. So that's kind of like I would live the rest of my life in a standard socket if that was my only option, if I could have my knees in balance. But there's also, like you were saying, what were you saying with the most to lose or whatever thing?
Oh, that quote?
Yeah, from the other video.
Yeah, we've been watching a lot of videos, but there was a really good quote that said, "It is the hardest decision for the patient who has the most to gain." So he really has nowhere to go but improvement, so it's just trying to find the best thing for him.
Yeah, okay, fine. I would think that you'd want to level your knees as well.
Yeah.
But I figured I'd throw that out there in case it's just too much. Because it's a pretty big reconstructive plan with basically 3 different operations.
So that's kind of what I was wondering, what would the process be with the knee surgeries, and how far along would I have to fully heal and whatnot from that to get started on anything else?
So the issue with lengthening the femur.
Hey guys, sorry, when I'm in for whatever, I just wanted to come in for 1 second. When I'm in your Epic chart, Daniel, for some reason you guys can't hear me, so I don't know why, but so I'm listening, but I'm in your Epic chart and I'm just looking at our last note. So Austin, why don't you keep talking? I'm going to finish reading that. I can't read it to you guys because unfortunately you can't hear me when I'm in your Epic chart. So, but I am listening.
Very interesting.
Okay, great. Yeah, so I think it's important for Dr. Shubin Stein to hear this too, is when we lengthen the femur, it puts a lot of stress on the knee joint. And if the knee joint is ligament deficient, then it can dislocate. You can actually dislocate your knee. So the more stable we can make the knee before lengthening your femur, the more successful the femoral lengthening will be. That's a kind of important concept.
Right.
We want to keep you stable. Now, the good news is that the lengthening puts more stress on the PCL, which I have to review. I think you have a PCL and you just don't have an ACL.
So I'm in here and I'm looking at your imaging. And when you and I spoke, which was I think it was May 4th, I was just looking at it. We did not have imaging to work from. For whatever reason, it wasn't in the system. So the last imaging I have available for you, Daniel, is from March of 23. Does that sound right to you?
Yes.
Yeah.
Okay, so that's all. It's going to be over 1.5 years old, and so we will need new imaging. But we can certainly look at like making a plan from these imaging. So I'm looking, and yes, so the concept, and I think Austin, kind of correct me if I'm wrong, the right knee is how many, about 5 centimeters shorter than the left? I mean, in terms of more proximal, the right knee hinge is about 5 centimeters, it looks like from the x-rays, more proximal than the left knee. Is that about what you see, Austin?
It's even more than that, honestly.
Okay.
I remember
So-
9 centimeters.
These are uncalibrated images, but
Yeah.
just roughly, yeah, you're looking at 3 inches.
Okay. Okay. So 3 inches, 6 centimeters. Okay. So,
Yeah.
so there's a couple things that I see and that we wanted to look at, and I'll still need more imaging on this. And I think we can start to think about what imaging we need to make a final plan. But essentially, your plan is to lengthen the femur to get the hinge at the same level. Is that right?
Right.
All right. And then the other plan, which I heard, but I'm not sure kind of when time-wise that would happen, is the osseous integration into the tibia for the BKA, for the below knee amputation prosthesis, right? Is that going to occur at the same time?
No, I would do that last, actually.
Okay, so you're first going to lengthen the femur. Is that correct?
Right.
Okay. So from my perspective, we need some imaging. This is where I'm so sorry that Nikki's not on, because I'm going to write this down and then we're going to work on it later. With you. Oh, great. Sorry. I didn't, when I said hello, Nikki, before, I was like, okay, so great. Nikki's on. So I'm looking at the imaging now with Daniel and with Dr. Fragomen, and we're just trying to figure out kind of stage wise when Dr. Fragomen does the femoral lengthening. And, you know, Austin, you and I share a patient who you did this with, right? So we delayed what we were going to do with the patella until the femoral lengthening was complete, only because obviously things get tighter. I do think that you have a very proximal, so you have significant what's called patella alta, Daniel, which means your kneecap sits high and dislocated. It's a chronically dislocated patella. So at the time when Dr. Fragomen does the lengthening, I do think it would actually help the lengthening for us to do all of our lateral releasing. So lateral lengthening at the same time. So releasing all the soft tissues around the patella. Mm-hmm. I might even consider, depending on how it looks, putting in the MPFL at that point. The MPFL actually shouldn't change. No, that's not true, because what I want to do is allow the patella to move with the femur as you lengthen the femur. Yeah. Otherwise, this will become more proximal, more tight, more difficult to kind of get back to where it's supposed to be. Absolutely. So I think that should be a joint surgery. I'm probably just going to do soft tissue releases at that point. I'm not going to do anything. Well, actually, I could move the tubercle, because the tubercle isn't going to change. The tubercle will not be affected by the lengthening.
Right.
Yeah, I might try to get the patella in place. Now, how quickly are you planning on lengthening it, Dr. Fragomen? Austin, how long does it take to get that 3 inches?
It takes quite a while, a millimeter a day for 80 millimeters. So take about 3 months of lengthening, and then another 3 months for the bone to consolidate.
That's actually fine, because what I want to make sure of is there's not unnecessary pull on the tubercle. So if I move the tubercle at the same time, the tubercle should be healed by the time that real pull starts. So that actually might help to tether the patella and like keep it down a little bit. Mm-hmm. So I would plan, Nikki, on a tibial tubercle transfer, large lateral lengthening. The only thing I wouldn't do is put the MPFL in. And the reason I wouldn't put the MPFL in is because I really do think that may change dramatically as you lengthen the femur. So we would come back to do the MPFL and hold the kneecap in the right spot. I'll make that decision at the time. And the only reason is obviously because the quad is going to be under a ton of stress. Yeah. The quad is going to lengthen. And my concern is as the quad lengthens, it pulls the MPFL. I think the tibial tubercle will be fine. I mean, the attachment, by the way, also by definition will be lengthened. But again, I think the tubercle will be healed by the time most of that stress comes on.
I think it would be smarter. Well, let's just say it's safer if we delayed the lengthening for at least a month or 6 weeks, so that the tubercle was really pretty well stuck before we started yanking on it. Because he may be quite tight, and he could get tight within a couple of weeks, and it
Okay.
could literally pull apart your tubercle.
Well, that's what I'm